I want to turn to healthcare now. That is one of our leading stories. Did President's healthcare speech offer anything really new and alter the debate on Capitol Hill, where Bloomberg's Peter Cook is in Washington with Dr. Mark McClellan, who ran Medicare and Medicaid under President Bush? Peter.
Betty, thanks very much. Mark McClellan is now director of the Engelberg Center for Healthcare Reform at the Brookings Institution, also a Bloomberg contributor, helping us sort out fact from fiction in this healthcare debate. As always, Dr. McClellan, thanks for joining us.
Good to be back.
Your impression of the president's speech, did it move the ball?
It had some important steps for laying out the president's position on key issues. We've still got a ways to go in this healthcare reform debate on resolving key controversies like the public plan option. So this is going to be with us for a while longer, but the president is very engaged.
Well, let me ask you about some of the things he said last night to see if you agree with what he said. One thing he said is most of the $900 billion price tag of this bill could be paid for through reducing waste and inefficiencies in the system right now. Is that accurate?
It is possible to get most of that $900 billion from reforms in payments in the Medicare program and elsewhere in the healthcare system. It's a question as to whether all of that's going to be waste. For example, many of the payment reductions are going to come from Medicare Advantage plans. These are private plans for seniors. Now, those plans are overpaid according to a lot of studies, but those overpayments go into extra benefits for seniors. So some seniors are going to see reductions in their benefits there, but there are better ways to spend that money in our healthcare system. So it depends on how you look at it.
All right. He also said that if there is a public option, he advocated strongly for it again last night, only 5% of Americans would actually choose it. He sort of downplayed the role the public option would play. Is that accurate? I know it's a GAO study that suggests that.
Peter, he did downplay it. It's a study from the Congressional Budget Office, but I don't think he's resolved the fundamental controversy around the public option. And my concern is that we've had so much debate about the public option and the role of government in this healthcare reform issue that we haven't had as much time to focus on all of the other big components of policies, like reforming insurance markets, like requiring people to have health insurance, like finding ways to pay for the cost. If we don't get more of the public focus and the congressional focus on those other issues, it's going to be hard for this plan to come together. He did leave the door open for compromise on the public option, but we've still got some more work to do.
All right, let me ask you about some of the specifics he talked about here, because for the first time he advocated publicly this idea about taxing gold-plated Cadillac health insurance plans, taxing insurers who offer those plans as a way to try and bring down costs. First of all, your sense of that idea, how much money will it make? Is it going to make that much difference?
It can make a big difference depending on how it's done. Economists generally think this is a very important step for helping to hold down health care costs. It can be phased in gradually, so it wouldn't affect very many plans at the beginning, but over time would provide a stronger pressure to keep insurance costs down. That's going to be a big component of the savings under the president's plan, and his embracing this idea is an important step. It's in Senator Baucus's plan, too. It's an important step towards getting this into the final legislation.
All right. Dr. McClellan, we've got some breaking news with regard to GM and Opal, so we've got to leave it there. Thanks, as always, for helping us out with this health care debate.